Hello, my name is Jessica Romero, and this is my presentation on the Discourse community of CRNAs. A CRNA is a Certified Registered Nurse Anesthetist, and like the name implies, they are a registered nurse who have a certification in anesthesia. They work in hospitals as well as other places that need anesthesia assistance, such as the military or dental office. Since they work in operating rooms within the hospital, they typically work in a team amongst physicians, surgeons, medical assistants, and other nurse practitioners. How long does it take to get their degree? It usually takes around 7 to 10 years, starting off with a BSN, a bachelor's degree in nursing, then working as an RN in an intensive care unit, and then completing an anesthesia program. How much do they make? According to the U.S. Bureau of Labor Statistics, they make a median annual wage of 2012 $650. Let's talk about an SRNA. Basically, an SRNA is a student registered nurse anesthetist. Before becoming a CRNA, SRNAs must complete a nurse anesthesia curriculum that includes preclinical practices and didactic simulation training in order to prepare them for the next phase, which is clinical training. What makes them a discourse community? A discourse community is a community of people who share common goals, styles of communication, and a specific Lexis specialized language. CRNAs meet that criteria of a discourse community by sharing common goals of providing anesthesia and ensuring patient safety. They also share a specialized language that is unique to the profession and have a communication style that is used to provide information and feedback between their patients and other healthcare providers. The goals of CRNAs. While CRNAs focus individually on the goals of patient safety and the administration of anesthesia, they collaborate with other healthcare providers, which collectively share the goal to provide optimal patient care. Their teamwork is essential for minimizing risks and enhancing the quality of care. Communication. Certified registered nurse anesthetists and other healthcare teams engage in communication and feedback through surveys as well as written and verbal methods to enhance their practice. They use a tool called the Surgical Safety Checklist from the World Health Organization to avoid mistakes during surgeries. Staff must carefully follow the checklist and confirm that they completed each task, and after the surgery, they are encouraged to give feedback through surveys about how the surgery went and how useful the checklist was. CRNAs use a specialized language. For SRNAs, once they get through clinical practice, they must be sure to understand anesthesia-specific terminology, such as concepts from anatomy, pharmacology, and equipment. Through simulations and hands-on activities, students build the confidence and apply their knowledge in preparation for real patient care. CRNAs also use specialized language related to anesthesia, but adjust their communication style based on the context and the audience. When interacting with patients and the surgical team, they use simple and clear language to ensure understanding and build trust, such as confirming patient details and addressing concerns. In contrast, discussions about anesthesia methods or physiological concepts require more complex terminology. Challenges that CRNAs face. Burnout is a big problem for CRNAs as they are caused by heavy workloads and stressful work settings. CRNAs often work long hours and have a lot of responsibility to keep patients safe during anesthesia. As burnout increases among healthcare workers, it harms their physical and mental health, leading to missed work, lower job performance, and poor patient care, which can put a patient's safety at risk. Solutions for burnout. Since it is a widespread issue for CRNAs and other healthcare professionals, there are effective strategies that have been put in place to combat the burnout. So this includes support programs, self-care practices, and connecting with peers. Recent research indicates that techniques like mindfulness, regular exercise, and maintaining a positive mindset can greatly enhance the well-being of CRNAs and help alleviate burnout. Many institutions offer support programs such as the Burnout Awareness and Coping Strategies Program, which emphasizes recognizing burnout symptoms and providing assistance to those in need. Ending thoughts. For me, I must admit that I regard the field of CRNAs as a commendable and honorable profession, given their role in caring for and treating patients, especially those with severe injuries. However, considering the high levels of stress associated with this profession, I'm still uncertain if it is the right path for me, as I sometimes struggle with stressful situations. I am still interested, however, of exploring the various sectors within nursing to identify which one is suitable for my skills and preferences. Here's my works cited page, and thank you.